Like I've said, this is the 20th week of the response to the pandemic, and we've been quite open and transparent with all what we've been doing as the Gauteng Provincial Government. And this we've repeated in all earnest, that these are the 6 pillars that our response is actually based on. And we have been working on all these 6 pillars ever since. The one important fact that we also want to mention is that our work is not without any faults, and we are continuously improving our systems and improving the response to make sure that it becomes so much accurate and precise and decisive in most aspects. We must also accept that it has not been a very easy time as the pandemic evolves and as the situation evolves in the country. We had to also make sure that the response remains relevant. This is the start, what we normally present, which is a national picture, which is the picture that usually is presented by the national minister through the NICD, which all of us receive before we sleep every night. And it just gives us an indication that South Africa has become within the top 5 of the countries that has got confirmed cases and active cases internationally. And we've got 408 or so confirmed cases, with almost half of that of those patients having been recovered. And our number of deaths is 6,093, which is something of worry because we don't want to be losing lives unnecessarily. And every life does matter in this regard, and we are in the business of saving lives. So the response also has to look at all the aspects of making sure that we do have adequate staff, adequate beds, and adequate resources to make sure that we are able to save lives. It's also important that we mention in this regard that the tests that have been conducted have passed the 2.5 million mark, and it's something that we appreciate in terms of the capacity that our laboratory services have been able to put up going forward. This is just a graphical representation of what the picture I've shown you in the previous slide. You will realize and also make sure that you understand that as of now, Gauteng is an epicenter, and we said it before that we are now in the middle of the storm, and 36 or so confirmed cases, 36 or so, 36% of all the cases in the country are found in Gauteng, and over 42% of active cases are found in Gauteng. And this is a figure that makes us the epicenter and also makes us the whole attention of the pandemic coming to actually Gauteng. This is the number of the recoveries. We want to also indicate to you that our recoveries have been increasing quite nicely in terms of the numbers that we have been having. At the current rate, we are almost at 77,000 recoveries, which is closer to our half, almost 52% of all the confirmed cases in the country. But in terms of our contribution to recoveries in the country, we are now, the leading in terms of the recoveries, because of 33% of all recoveries are coming from Gauteng. In terms of deaths, like I've said, these are regrettable deaths, and we normally want to express our condolences to the families and friends and colleagues of all those who have lost their loved ones, and also in this point appreciate the role that is played by our healthcare workers who took effort and make sure that they tried to save lives, and we like to appreciate their effort and also indicate our appreciation in that regard. This is a graph that we normally show you, which clearly demonstrates how the pandemic is evolving in Gauteng, and you'll realize from the past weeks we were worried on how the green graph was actually moving away from the pink graph being the active cases. And now you see that it started now to show and become what we really want to see, which the green graph, which is recoveries, representing recoveries, starting to be more than or even go further from the active cases. And the point of intersection for us, it gives us a bit of hope and excitement that, yes, indeed, this virus or this pandemic can be beaten because the majority of those who are infected, they do recover and without many of the sequelae problems. And this is how we are looking at it now, and it's quite hopeful. It gives us hope and courage that we should be doing more and putting more interventions in making sure that this green graph does approach also even the blue graph, which is something that we are hoping to see in the coming weeks or months forward. This is the number of cases. Now in this point, we compare from previous week to the current week. And just to emphasize the point in terms of the confirmed cases, you'll see our increase has been very drastically up from last week. Last week we were on 117,000 cases. Today we're on 148,000 cases. And also of importance is we have increased in terms of active cases to around 70,000 from around 65,000. And in terms of recoveries, we also have increased tremendously, which is one thing that I've indicated before, that it gives us hope and it gives us courage on how we can be able to defeat the pandemic and defeat the virus. And the more the recoveries, the more we are actually giving hope and courage in that regard. The death the mortality rate still is around 1%, which is something that we'd want to keep it there, though any life lost is a regrettable point, and we like to express our condolences in that regard. This is a graphical picture of the new cases per day. You will see how our graph is looking at, and we are hoping that this graph will maintain its downward stride. We are not yet excited about the downward stride because it's not really saying that the pandemic or we are over the peak. It just means that most of the efforts that have been put in are working, and we just need to continue to put more efforts and interventions to make sure that the downward trend gets sustainable, and it's something that we are looking forward to. So not to belabor the point, you will see that ever since we had our highest point, highest number of daily increases, which was 6,531 on the 9th of July, we have never seen such a spike ever. And we did have one of the lowest on the 20th of July, where we had one of our lowest daily increase, which was around 3,000. But it's a pattern that we are observing, and it's something that also gives us courage and strength to make sure that we are able to move in this regard. This is the next one, which is the regional breakdown, like in terms of representing what our regions, our districts in Gauteng have. We do have 5 districts, and Johannesburg remains one of the highest. In essence, what we normally say that 85% of all the activity of the pandemic, you find them in the metros, the 3 metros in the province, Johannesburg, Ekurhuleni, and Tshwane. Our worry is just to see the number of active cases in Sedibeng, which in terms of the per capita in population, it's something that worries us. We are, like always, having to work with NICD to try and get rid and make sure that we are able to reduce the number of the unallocated actual figures, which also continues to rise, and it becomes a worry point. And as the data continues to be cleaned up and processed, and unallocated figures, we expect them to actually be lower. This is in terms of the sub-districts. You'll see that the sub-districts that have got the highest cases are found in Johannesburg, and this is one of the things that made us to even take an effort from the side of the command center and the nerve center of the public health response to visit one of the areas which we found to be very problematic in terms of active cases, and we will give report as we go on what we found and how we're going to be moving forward in that regard in terms of ward-based approach and activation. This is in terms of the highest confirmed cases and active cases per district. Like I've said, Johannesburg still remains the highest in this point. The next slide will actually talk to the highest number of recoveries, which is, before that, maybe just to talk about the highest number of active cases, which will be in Johannesburg, and followed by, worryingly, like I've said, by Mfuleni, which is in terms of the per capita population, it's something that has to be sorted out, and we will have to visit them and see how we can be able to put in some intervention to make sure that we are able to control the spread in that area of Mfuleni. This is just the highest number of recoveries. As we have indicated, that we are going to be seeing more recoveries in the coming weeks, because the number of those who are hospitalized still remains pretty much constant within what we have been expecting in terms of the percentage, and those who in the main are recovering are those who've got mild and even actually moderate symptoms. But it's important to maintain and also say that, yes, we do have discharges. People do leave our hospitals alive. Even those who are in the highest group of risk, the highest risk group, they do get actually discharged, and they do recover. This is the daily increase in terms of the cases per sub-districts, which is something that we normally demonstrate to check where the hotspots or the areas where we need to put focus on. It's important for us to make sure that those who require help urgently, they do get it. And we know oxygen, IV fluids, intravenous fluids, and also some anticoagulants, they do come in handy in this regard. Maybe just to also mention, whilst we are here, that we are dealing with a number of individuals, a company that is bringing remdesivir into the country, one of the drugs that has been licensed and has been seen to be quite beneficial in treating patients with COVID-19, and we are working with them on how we can bring in more stock and be able to utilize that stock within our hospitals, so that we're able to save lives. The dexamethasone has been used, and we are continuing to use it. Hence, I think it contributes to the low number of our mortality rate in this space. This is a slide that deals with the number of our provincial figures. Like I've said, next week when we come together, we will clearly be over a 1 million test, which will be a very big milestone, that in 20 weeks as a province, we're able to test over 1 million people, or having had 1 million instances of testing, which is something that is a remarkable feat in this regard. And Gauteng still remains the bulk contributor to this one. And the more we test, the more we reduce the productive rate, and how we actually determine the positivity rate that we need to actually lower and continue to lower. So the more the test we do, the more we know the status of individuals, the better. But also in this regard, it's important to mention that we have changed our strategy in terms of testing. Those who are tested now, in essence, are those who are in hospital, and our healthcare workers who are the most highly infected in this regard. And it's something that is important that we emphasize, that our testing approach has been changed, because we will also still want to save and reserve the testing kits, particularly for those who will require and need it, particularly those who are symptomatic and who require hospitalization or medical help. This is just a scenario which in the coming week we are going to share with you the progress that we've made in the past 2 months between June and July, and see how far we are. But this is just what we've been using as a basis for our planning and our basis of our resourcing of the department. It also speaks to where the peak would be. which we have always said that it will be towards mid-August, towards the end of September, and hopefully, as we are in the middle of the storm, when we get there, we would be having enough experience in dealing with the pressure and the stress that comes with dealing with the storm. The next slide just deals with the number of infrastructure beds that we have put in. Last week, you'll recall that we had over 8,700 beds, but in the past week, we have added a couple of beds, including the ones in the field hospitals. You see there the additional field hospitals that are continuing to be added. We're looking at Nasrec, which it's one of our field hospitals, and we need to be very proud to indicate that the beds that we're adding in Nasrec, they do have a capacity to be escalated, to give oxygen, and also to be able to give some intermediate care in this regard. And work will be starting in earnest in Tshwane to make sure that we continue to add these beds. And as yesterday we welcome the additional boost in terms of resources that have been allocated to the fight against the pandemic. But this is just an indication of what we have been putting up in the space. This is the work that will be there, that is continuing in terms of the ABT, Alternative Building Technology, which is a word that will be repurposed going forward. This slide, you will see how different it looks from what it was before, but it's just an indication from our point of view of the number of patients that are in our hospitals in the public sector and those who are in the private sector, and those who are in high care and high care and intensive care units. And these are patients that require more attention and that we are continuing to observe and actually monitor. This number is becoming, I think from last week, what we had was around 5,000 or so, 700, and now we're on actually 7,000, just as an indication of the pressure and the intensity that we are feeling in our facilities. In this regard, we are perfecting, like I've reported 3 weeks ago, that we are having a bed management team that every day, every morning, every night, they do a bed count and make sure that we're able to direct the traffic and to direct the traffic flow of the patients where they should be admitted. I think the most frustrating part would be that when people require a bed and they might not be able to find it, but this team makes it easier for us to manage that particular aspect. At the current moment, the EMS is the one that is doing it quite well, and we are continuing to utilize that aspect. This slide just indicates the number of the public servants in Gauteng that have tested positive, and you see the number continues to go up because these public servants, they do stay in the communities and they will be affected by some of it. I know that I did indicate last week that most of our public healthcare workers who were found to be positive in 3 institutions are people that were not working directly in COVID wards, but working in the facilities themselves. And that doesn't suggest that we mean that they've not gotten infected from where they work in the hospitals or clinics, but it's just an indication of the survey that has been done in those particular facilities, where the majority of those who were found to be positive are not those who are working in the COVID wards, but are those who are working in other wards and in other areas in our facilities. So we are not downplaying the issue and the importance of us as government to provide adequate training and adequate PPE of quality. Yes, I did indicate last week that we are now dealing not only with the numbers of the quantity of the PPE, but just to continue to improve the quality actually thereof. And we do welcome feedback from our healthcare workers where they found that some of the PPE is of low quality, and those companies, they should be actually dealt with in a manner that they will make sure that they do provide quality PPE going forward. And we have lost 12 educators ever since, 1 administrative assistant from the Department of Education, which is a big loss for us. When we lose our our educators, it becomes a big problem. We also this week report we have lost a professional nurse. Like we indicated, as a Gauteng Provincial Government, we like to express our sincere condolences to the family, colleagues, and friends of those deceased, and also express our appreciation to the healthcare workers who have put in effort in trying to save their lives and managing their disease. This is just the indication of the PPE on stock, and will indicate to you that this is what we have on stock. You will see the number continuously go up because we don't want to get to a point where we don't have enough PPE. In this point, I'll just cover the food aspect of it, that we are approaching a 2 million mark, which will be one of the great needs, a great feat that we would have achieved as the Gauteng Provincial Government. It means these are the number of people that would have touched and also contributed in the food relief scheme that we're having. And our call center continuously gets increased number of calls to make sure that we're able to deal with it. So in the next slide, we're just going to deal with the issues of education, which the HOD will gladly assist us in that regard. Thank you.